Hello, I'm Gina. I'm an advanced practice nurse working in breast care.
And I'm Amy. I'm a breast nurse navigator at Research Medical Center.
As we approach Mother's Day, we wanted to take a moment to talk to you about an important topic that applies to mothers and women everywhere: mammograms. Amy, can you talk a little bit about why mammograms are so important?
Mammograms are the gold standard for finding breast cancer, so they really are a life-saving screening. A mammogram is simply an x-ray of the breast tissue. It is a way to screen for any abnormalities in the breast. Do you want to talk about who needs a mammogram?
Sure. The American Cancer Society recommends that women start annual screening mammograms at age 40. Women can walk into either the Research Brookside or the main Research Medical Center campus and get a screening mammogram. No prior appointment is needed, and there's 3D mammography available at both locations. The staff really will make it so easy for a woman to take care of herself and to really stay current with her health screenings. Let's be honest though, Amy, I think we all know women who got regular mammograms but still ended up with breast cancer. Do you want to talk a little bit about that?
Yes. Mammograms don't prevent breast cancer. I wish they did. The point of mammograms is to detect breast cancer. They can pick up subtle changes in the breast and can even catch precancerous areas. With any cancer diagnosis, the best chance for a cure is finding it early. For breast cancer, early detection is the key.
You bring up a really good point, Amy. Mammograms detect breast cancer before there's a lump that can be felt. And the American Cancer Society no longer really pushes women towards doing those monthly self-breast exams. Their current guideline is that anyone who has breasts should be familiar with how their breasts look and feel. If somebody notices a lump or a change in their breast, they need to call their doctor and ask for additional imaging.
Yes, many times if women notice a change in their breast, a diagnostic mammogram, ultrasound, MRI, or biopsy might be needed. Those tests require an order from a healthcare provider. If a woman feels a lump but doesn't have a doctor, she can contact the HCA Midwest referral line at 816-751-4884.
We've been talking about women, but I think that we need to acknowledge that men can also have breast cancer. Breast cancer is a rare cancer for men, so there's not a regular routine screening that's recommended. However, there is a Male Breast Cancer Coalition that can provide information. I think we'll put that website down on the bottom of the screen. And if a man finds a lump or a change, that the same thing applies. They need to contact their physician and get an order for additional screening. Nobody wants breast cancer, but what can people expect if they're diagnosed with it?
My job title is Nurse Navigator, and that's what I do. I navigate people through the process of diagnosis, getting necessary consults, treatment, and beyond. When I start with a person who has a diagnosis of breast cancer, I know that we are going to be in it for the long haul. That is really one of the best things about my job. I get to develop real relationships with my patients. I support them from the day of diagnosis all the way through survivorship.
Having a good navigator through cancer treatment is so powerful. So thank you, Amy, for what you do. I want to make sure that we're not scaring people away with all our cancer talk. The vast majority of mammograms are completely normal, right? And don't show breast cancer.
True. We all love to get a normal mammogram. It's just so important to stay current with all our healthcare screenings. In this spring season, as we slowly emerge out of the pandemic, we really want to encourage everyone to get their mammograms and other screenings done. It is so easy to get lost in the busyness of our life and push our own health to the background.
Yeah, but as you said earlier, mammograms save lives. As women and mothers ourselves, we want to push everyone watching this video to make themselves a priority. Everyone, listen to your body. If you feel something is not right, please reach out to your healthcare provider. And for women who are over 40, please get a mammogram. It's important, it's worth your time. It's how we ensure that we have many more Mother's Days to come and many more years that we can celebrate with our friends and family. Thank you so much.
Thank you.